We have spent a lot of time internally and looking at survivorship care plans that have been suggested by both the American Society of Clinical Oncology, ASCO, looking at what the NCCN recommends in their standards for survivorship care, and trying to gel that with our electronic medical record. And I think we have found that the important thing is to strike a balance, to recognize that these care plans need to do two things. They need to summarize the patient's treatment, but not duplicate the medical record. And so we've really tried to focus on what are the drugs the patient received, what kind of radiation did the patient receive, but not necessarily all of the dosing, because if that becomes an acute issue down the road of having to know that, what's really going to be important in that care plan is who are the providers that can be contacted here to, say, review the detailed radiation records for a patient that may have moved away and had a local recurrence. And so I think we've decided that enables us to strike a balance between having too much information that's not manageable on the treatment summary, and instead balance that with ongoing surveillance, health maintenance, and a clear understanding of what the follow-up care should be. So the patient has that for other providers, and especially when patients relocate, which happens often.